items lying around on the bedside stand or other area close to where your patients might be. And also be sure that you're putting away all of these medications, and finally wash your hands when you're completed with all of it. As a nursing assistant, you may be expected to use medicated shampoo as well. This might be used as part of routine hair care for an individual. Physician's order need to be obtained for use of medicated shampoos. There are various types of medicated shampoos that are used depending on the patient's problem. If the individual has, for example, psoriasis, they may have one kind of medication. Dandruff calls for another. Head lice is still another. Medicated shampoos have very strong chemicals in them, so you would want to be very careful to protect the patient's eyes when doing this by use of a washcloth. Usually these medicated shampoos are stored in a locked cupboard and also tightly capped between use, to be sure that some individual who might be confused wouldn't be able to get them and drink it. Read the directions very carefully. For example, some need to be shaken well before their use. Some need to stay on the scalp for a period of 5 to 10 minutes. So be certain that you know exactly how this medicated shampoo is to be used effectively. I'd like you also to refer to the student manual that you're currently using, to the pages that follow this outline for additional information that's provided about the use of medicated shampoo. Medicated baths is also a treatment that you may assist with. The medications that you might be used in a bath could be coal tar, saline or salt solution. Oatmeal might be applied to a medicated bath. Sodium bicarbonate, which is common baking soda. Or rubbing alcohol might be added to water and providing some help to the individual. All these things have specific ways in which they benefit. Some help lower temperature, as with the rubbing alcohol. Some of the other products, like the coal tar, is used for psoriasis to help decrease the itching and so forth that go with that. For any of these products that you use, the procedure for giving this bath need to be followed very carefully. First of all, you'd want to clean the tub extremely well before the individual gets into it. The patient should soak in the tub usually about 20 or 30 minutes, unless you've been given other specific orders by the nurse. The person's body should be covered as much as it can be in order for the medicated water to be most effective. Once the bath is completed, you would want to pat their skin dry as opposed to rubbing it vigorously, so that not only the medication can stay on, but that you're not causing any additional discomfort to the individual. Clean the tub thoroughly after it's used, particularly if you can think if you were having a product such as coal tar in the tub, it leaves a real scum and ring around the tub that needs to be aggressively removed prior to its use by someone else. Use extra precautions, as these medications can make the tub especially slippery also. So be careful when you're getting them in and out of the tub, and assist them as needed. Now I'd like you to watch a demonstration of applying a topical medication to the skin. Wash your hands and obtain the supplies. Identify the patient and explain the procedure. Check the 5 rights. the right patient, the right medication, the right time, the right route, and the right dose. Provide for privacy. Position the patient so the area of application is accessible. Observe the appearance of the skin. Apply an underpad protector. Cleanse the skin with soap and water or as directed by the nurse. To apply the medication, don your gloves. Open the container and place the cover upside down on a clean surface. Dip the tongue blade into the container once. Try to dip out the entire amount needed for one application. Use a light stroke with the tongue blade. Apply a thin layer. If more medication is needed, use the other end of the tongue blade or a new one. Remove your gloves. Dispose of the supplies in the appropriate place. Assist the patient to a comfortable position. Put away the medication, wash your hands, and report any observations to the nurse.